My mom's job doesn't offer insurance. My dad got laid off.
The man next to us in line is in a wheelchair.
I'm on disability, and nowadays you just can't afford it.
My grandfather ran out of money.
One woman told me she didn't have a home.
In Connecticut, the state takes care of us kids. But who will take care of my mom and dad?
After a long, pleasant, wonderful morning and afternoon, we're getting into our van, and we're going to unload, and we're going to start our 7th annual Mission of Mercy for Connecticut. Let's do it! With that first row where all the utilities are going to be lined up, that'll be there.
Momentum is building. Excitement is building.
We are setting up a state-of-the-art dental clinic.
And everything here is top-of-the-line equipment. Top-of-the-line manufacturers provided this equipment, designed it just for this application. So when somebody gets treated here, they're getting the best quality care possible.
We're not a charity. We're really an investment in the health of the people of this state.
Yeah, the first patient arrived today, which is the day before we actually have the clinic.
I got here 7 a.m. this morning. Well, really, I'm not hurting in my mouth right now because I had most of my tooth pulled, which I did it myself, right? I went to the dentist in 2006. I had one tooth pulled. At that particular time, they said it's going to pull 11. 11, I got scared and chicken out, and I never went back to the dentist no more. Then I started pulling myself.
And I'm here to grace of God to help me, and I hope a lot of people take advantage of this because people need it.
When we walk the line, which is what you call visiting with the folks during the night, it's hard to believe that these people have been out there for 7, 8 hours and that they are, you know, you say, hi, how are you? And they're smiling and they're happy and they're thanking us.
We're all here so excited to go to the dentist. Like, it's a weird experience here. So it's like, oh yes, we're camping out and we're going to get root canals and teeth extracted. So it's kind of a bittersweet kind of thing.
We came last year, we didn't know what to expect. That was our first time. I had 2 front teeth here that were completely shattered. They're broken apart, and they gave me 2 brand new front teeth. Everybody that's within our little group has already been several times. I got a few cavities and maybe a cleaning.
One filling that's breaking and another one that's half broken off. So hopefully to get it filled or kept.
We're very, very happy to see you all. We hope that we can take care of your problems today, and I love your energy right now. After sitting out here all night, you guys have been terrific. And we're really happy, that
you're
you
here.
came down, and we're glad, and we hope we can take care of your problems today. So thank you and welcome, and we're going to go through those doors.
We've got actually 1, 2, 3, 4, 5, 6 intraoral rooms going and 2 panoramic. You bring the patient in and then you exactly measure it to the patient's mouth and their dimensions. The machine just kind of knows what's going on there by the dimensions that you set into it. You set it in, they bite on a little bite block, a few seconds around the head. Beautiful image here. Comes up digitally. And then you can, we take it, we send it to the printer. It goes over to the dentists who are doing the work, and they've got the image to work with. I do this because I love the people. I love the people. And we sometimes see them come through again. They get in line, they get a procedure done, they get in line again.
My front tooth I got fixed, and it's actually worked out really good. Now I'm just getting a couple cavities taken out. That's about it for this year.
This is the oral surgery section. We have 45 to 50 chairs here. Here is mostly extractions. We'll do some biopsies. We do have translators. Anyone comes here, even if they can't speak English, they're going to get treatment.
Lady who did my root canal, I just had to give her a hug, and I gave the assistant a hug because without them, I was a wreck.
Doing a pregnancy clinic. In the pregnancy clinic, we're going to be teaching and helping and treating so that they'll know how to take care of themselves and their future babies.
I'm Carla Andrews, and I'm pregnant, and I'm 15 weeks. I couldn't sleep at night. It was really bad. It was worse than giving birth to my first child. It was I had a heartbeat in my mouth. It hurt really bad.
What happens is those blood vessels are carrying germs from the mouth to the rest of the body. It can affect the fetus. It can affect the whole outcome of what's going to happen healthcare-wise.
I'm just new to the area. I lived in Virginia Beach, and I've never seen anything like this. The people they're great here. It makes me want to cry, like really, like.
It broke about 5 weeks ago, you know, and it's embarrassing. And I knew this was coming up, so that's what I did.
She stands in the patient's tooth, and then she's going to check and see where the margins of the tooth are. Then she's going to fit the contacts, and then she'll fit it to her exact bite. So we have control of the exact form and function of the tooth.
Awesome. Fantastic. See that?
Make them smile literally, but also figuratively, to give people their self-confidence back, their ability to smile wide and take on a job interview.
Thank you. Appreciate it.
Anytime. Anytime. You're a great guy. Yeah.
I do this because I love to help people and I love dentistry.
Lets people know that there's still so many people willing to help each other. That's what it's all about.
It lights up your spirit. You know you're helping the patients, and that's really what it comes to. This project is all about the patients.
I'm a thrilled person right now because I have a brand new tooth, and it was broken.
If you just want to go somewhere where you generally feel cared about and you know that they really care about the final outcome and not, I don't think they're about paychecks here. I think they're about genuinely making sure that people walk out and can function, and it's a big deal.